From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. If you wear makeup regularly or even just for special occasions, you've probably never thought twice about how it might affect your eyes. But the truth is, what we put near our eyes matters. From mascara to lash glue, certain products and habits can impact things like dryness, irritation, and even infections if we're not careful. That's why today we're getting into the eye-opening truth, literally, about makeup and vision. And who better to guide us than Dr. Rupa Wong of Honolulu Eye Clinic. She's a board-certified ophthalmologist, fellowship-trained at Harvard, and someone who does an incredible job of making eye health approachable. You might know her from YouTube or Instagram at Dr. Rupa Wong, where she shares smart, practical advice about everything from screen time to floaters to contact lenses. And yes, safe makeup habits too. Today, she's here to talk about the do's and don'ts when it comes to beauty and eye care, and how we can protect our vision without giving up our routine. Today on Care Experts, we have Dr. Rupa Wong joining us. Thank you so much for being here today.
Thanks for having me.
I'm excited to talk to you all about eye health and makeup. I thought we could start off with a little icebreaker game. I call it I love it or I don't love it. It's pretty simple. You just tell us your thoughts on the following things, okay? So number one, sleeping with eye makeup on.
Ooh, don't love it.
Don't love it.
Never.
Okay, we're going to get into the nose around. We're going to go into more detail with all of this in a second. Applying eyeliner on the waterline.
Totally don't love it.
Using makeup in the store.
Nope.
Just
one word. Nope.
Okay.
That's a full sentence.
Taking your makeup off with makeup remover wipes.
Not my favorite.
Not your favorite.
Not
okay.
my favorite.
Using eye makeup you've had for years.
No. Oh my gosh. Everything is a no. Don't love it.
I'm learning so much already. Wearing false eyelashes daily.
It's all right. We'll do a caveat.
We'll do a caveat. Okay, I have questions there.
Yes.
And then the last one, sharing eye makeup with a friend.
No.
Really?
No.
But what about those nights when you were getting ready with our girlfriends
I know,
to go
we all
out?
did it. I think especially I think it's fine for things like eyeshadow. It's probably not a lot of bacteria, especially if it's a powder base.
Okay.
But mascara, eyeliner,
not happening.
Not happening.
Okay, let's dive into this and talk all about makeup, how it impacts our eye health. I'm not going to lie, I'm a little bit nervous for this as somebody who is very fair. I have teeny tiny eyelashes, so I've been wearing mascara as long as I can remember. What are some of the concerns around makeup and our eyes?
And don't worry, I'm not going to tell you can't wear eye makeup anymore. Obviously, that would be terrible for me included. But a lot of people don't realize. I mean, you know that you're putting makeup around your eyes, but it can actually affect your vision in a way because eye makeup can block the oil glands along the eyelids. It's introducing kind of a foreign material, so that can introduce bacteria and it can clog those oil glands. So there's a lot of different things that it can do, as well as disrupt your tear film. So people don't think about your tears that much, but your tear film and having a really nice, healthy tear film is actually responsible for a good part of the clarity of your vision. So if your tear film's not healthy, people notice it. They say, oh, my vision's blurry and it's like I gotta blink and it's kind of comes and goes. That could be from your makeup.
I've absolutely had that before, and I'm already realizing that I don't know a lot about the anatomy of the eye. For example, I didn't know that we had ducts on our eyelid.
Yeah.
Can you just give us a basic 101 of the eye
to
start off with?
Absolutely, and especially as it pertains to eye makeup.
Yes.
So the eyelid skin around the eye is the thinnest skin in your body. So you have to always be mindful of that whenever you are putting on eye makeup and even when you're removing eye makeup because you want to be gentle. None of us, of a certain age want those fine lines and wrinkles around your eyes.
No.
So one way to avoid it is just to be really thoughtful and intentional about how you remove your eye makeup. then there are actually oil glands along the eyelids, both the top and the bottom, right where the lashes are. They're called meibomian glands, and they make the oil for your tears. So your tears aren't just made up of water. They're made up of oil, fat, and water. So if that oil doesn't get into the tear film, then your tears evaporate really quickly, and that leads to symptoms of dry eyes. So that's a big problem for a lot of women, especially women of a certain age, especially women that are wearing a lot of eye makeup, because what are you doing? You're putting eye makeup right where those oil glands are. So there is the potential to block them.
Wow. Okay. So are there any things that we're doing with our eye, whether it's eyeshadow, eyeliner, that particularly cause issues?
The number one thing I see, which I know a lot of people are just, don't hate me for this, is tightlining or putting eyeliner in your waterline. It's just so bad for your eyes. And occasionally I do it too. We all do. But it's not something you want to do daily. It's blocking the oil glands right where they are making the oil for your tear film. So it can cause inflammation of your eyelids and even styes. I had a 15-year-old that was doing white eyeliner in that, what we call the mucocutaneous junction to make the eyes pop.
Yes.
Huge sty that I had to remove in the operating room. So that's my big pet peeve, is when people say, oh, it's ophthalmology tested for the waterline. I've seen that on some eye products. Totally not a thing. There's nothing that's safe to put on your waterline.
Wow. I mean, the marketing on these products, we have to remember that there's no regulation around what they're saying. So
Exactly.
we've got to listen to the experts, which you are. When you say not to line the waterline, you're talking about the part of the eye above or between the lash and the eye, right?
Yep. So that's called, and I'll pull down, the mucocutaneous junction, that pink part right there. And so you really don't want to line in there, because there's no good way to remove the eye makeup from there. There's nothing that's formulated. That's such a sensitive part of the eye. You can't use makeup remover right in there. Now, getting really close to your lashes, that's certainly fine. But putting it on that waterline, that's a no-go.
Not ideal. What are some symptoms that you would see that might indicate your eyes are being irritated by makeup? And are these serious problems or just kind of an inconvenience?
It depends. So if you have redness or itching, some people might even have light sensitivity or blurred vision, like we talked about, because if they get that disruption of the tear film, can have inflammation of your eyelids or recurrent styes. So it might just be a minor inconvenience, but sometimes then if you get a sty, that can be painful. It can be something that doesn't look all that great, and sometimes even require surgical intervention. So those are things just to be thoughtful about.
Okay, so if you're noticing itching, dryness, blurry vision, you might want to look at the products that you're putting on your eyes every day.
Absolutely.
I'm very curious to know if there are any ingredients that you would absolutely avoid or ingredients that you would look for in a makeup.
So for makeup, I personally don't like waterproof eye makeup, and that pertains to eyeliner or mascara. So the reason for that is usually they're going to be made with parabens, because that's what helps keep them waterproof. It is much more difficult to remove waterproof makeup. So not only the amount of force and traction you need to put on those delicate eyelid skin, right, causing wrinkles, which nobody wants, but it's also just harder to remove every single bit of it. So that's then going to harbor bacteria if you can't get all of it out. So it's not my favorite. Sometimes the chemicals also can be a little bit more irritating. So I tend to shy away from anything waterproof.
Okay.
Not my fave.
Earlier, you touched on false lashes and whether that's a more permanent long-term lash or a daily lash use. What are your concerns with that?
So let's talk about the permanent ones, like lash extensions.
Okay.
The biggest thing that I see with lash extensions is that, and I've done them in the past, there's no judgment here about lash extensions, but the biggest thing I see is that people don't clean them, because they're so worried about losing the lashes. So they're not cleaning those lashes every day, because they think, oh my gosh, that's $20 down the drain for each single lash that's hitting the sink, right? So, and that's a problem, because if you aren't cleaning your eyelids every day, especially when you have lash extensions, it's just the perfect environment for bacteria and also lash mites, which I know nobody wants to hear about. But lash mites they proliferate in that really warm, humid, environment. So
Wait, what is a lash mite?
a lash mite. So everyone has some amount of lash mite typically, but what we're finding is that a lot of the problems with inflammation of the eyelids or even maybe styes can be explained by lash mites or Demodex. So that's something, if you look at, once you see a picture of what it looks like, you're going to start cleaning your eyelids real well every day.
What? I had never heard this. So you're saying we all have
We all
lash mites?
typically have a little bit of lash mites, just like think of it like your gut microbiome.
Okay.
If the environment around your eyelids isn't like, it's in a good steady state, it's not a problem. But when you're not cleaning your eyelids, when you're not removing your eye makeup, it can throw it off balance, right?
Okay.
And so then those lash mites proliferate and they cause problems. So don't want that.
No. Let's talk about cleaning your eyes and cleaning off your eye makeup properly, especially now that we know about these lash mites. How would you recommend that somebody goes about doing that?
So there's so many different ways to clean your eye makeup. I think the biggest thing is, number one, that you do it.
Yes.
Don't go to sleep at night with eye makeup on. That's really when those lash mites love to come out and to overpopulate the eyelid region. So you don't want to do that. You want to use something that's really specially formulated for the eye area. I see a lot of people, it's one of the biggest mistakes I see, is just using their facial cleanser for their eyelids. That's what can cause the stinging or the burning. I personally like tea tree foaming cleansers. There's a lot of antibacterial or hypochlorous lid wipes that you can use, and they're a little bit better than like a makeup wipe. It's actually foamy formulated cleansers that can use to really get rid of all the oil and dirt and debris and bacteria. So I can even use micellar water is great to really get a nice clean. I personally like to do a double cleanse. I know that might seem excessive, but it's just the only way to get your lashes feeling like really squeaky clean. And that's honestly going to help promote lash growth. A lot of women want longer lashes. That's why they do the extensions or the dailies or the mascara. But if you just create a good base of nice, clean, healthy lashes, that's going to help keep those lashes around longer. And I think sometimes people don't realize that.
Okay, such a great tip. And I feel like you've seen a lot under the microscope in surgeries that you're doing. So once you've seen that type of thing, you can't forget it.
You cannot forget it.
And now you're just committed to the double wash.
Just Google Demodex lash mites, and then everybody's going to be like cleaning their lashes.
Very motivated all of a sudden.
100%.
So when you're washing your face, are you dabbing your eyes? Like what because I was doing this. If you're not watching the video right now, I am aggressively scrubbing my eyes. But are you mostly dabbing and just gently? No,
I am not dabbing. I am scrubbing. I will tend to scrub with circular motions. Again, if you're not watching the video, the eyelids. So I really do want to get into that lash line, to that lid margin, and get rid of all the debris. Dabbing's not going to do it.
Okay.
So, I mean, you do want to be gentle. You don't need to be aggressive about things, obviously. But you do need to, get a little bit of force in there to at least get rid of, loosen up the dirt and debris that's adherent to the lashes.
Okay. Now, any ingredients that you absolutely love in a makeup, or any products like tubing mascara versus regular mascara that you would recommend?
So I do really like tubing mascaras. Now, tubing mascaras are different than fiber mascaras. There are some mascaras that have fibers. I don't love those because they can actually get stuck in the eye. There have been case reports of them getting stuck underneath the eyelid. So fiber mascaras are different than the tubing ones. Okay. I love tubing because it gives you kind of a waterproof type longevity to your mascara without actually being waterproof, because you can just use warm water and it comes right off really easily. So I really like a tubing mascara. That's one of my favorites for mascaras, for sure.
When it comes to eyeshadow, do you have a preference between an eyeshadow powder that you would normally get in a palette versus a cream eyeshadow?
I love personally using an eyeshadow stick. It's just really easy. It looks like very simple and very natural, especially since I'm in Hawaii. When you are using a cream-based or kind of a stick, you just have to know that you might need to toss it a little bit sooner than you do an eyeshadow powder. But a powder has particulate matter. So that debris can fall into your eye and irritate your eye. So that's kind of where you have to look at it. But a powder, you can kind of hang on to it for a little bit longer because it doesn't trap bacteria as much as a cream is going to.
What are your thoughts on glitter eyeshadow?
We all love glitter, especially for, a big makeup event, for costume parties or galas. But glitter particles, and there's some that really, you can see them on social media. They've got big particles of glitter that easily tends to fall into the eye. And it can even scratch the front surface of the eye, makes you feel like really irritated, foreign body sensation. So with glitter, you've got to be really careful to just make sure that it's not getting in the eye. And even throughout the course of the day, as you're wearing it, can still continue to fall into the eye. So definitely not something I'd recommend as a daily use type of way to do your eye makeup.
Okay, amazing. So avoiding waterproof mascara in particular, but eye makeups, and then perhaps considering switching to a tubing mascara or a cream-based eyeshadow. Any thoughts on eyeliners?
Eyeliners, you can use either a pencil or a liquid.
Yeah.
The thing is, if you're using a liquid eyeliner, you really want to throw it away every 3 months. A pencil eyeliner can last a little longer. You could do every 6 months for that. So either one is fine. Again, waterproof eyeliner, don't use something because you think it's supposed to be good. It'll stay put in your waterline or tightline. It's just like a dam. It's just blocking everything up for those oil glands. And I personally really like mini travel sizes for mascara because you are forced to, you're going to go through it. If you use mascara every day, it's going to be done in a couple of months and you're going to rotate and get a new one. So I will buy a lot of the mini ones just for using on a daily basis when I'm at home, not even when I'm traveling. So I really like that as a quick hack too.
Okay, this is so good for me to hear and embarrassing to admit, but I'm going to say it because I feel like there are probably lots of people out there. I have makeup palettes
Me too.
and like eyeshadows from 10 years ago probably, and I don't wear it that often, but every once in a while you feel like getting creative and then you pull out this old makeup, but you're saying no, not
well,
exactly.
Eyeshadow, if it's powder based, you need to probably toss it every minimum. I mean, at the longest, at the longest. Was that maximum? I'm not sure. Every 2 years. Okay. So those ones that have been around for a real long time, and you'll see that they also lose their pigment.
Nothing good going on in there.
Yeah, so just toss it. It's so hard. If you saw my makeup drawers, I probably have like 10 palettes. I love palettes. It's the one thing I'm always like, ooh, I don't have this color. And then I buy a whole new palette, right? But it is something you just want to be mindful of. And it's hard because there's no expiration dates on the palettes. There are expiration dates usually on mascara, but it's typically on the box.
Which we throw away. So it's really hard to remember. That's why, as much as possible, I try to get mini sizes of the things that are more gel or liquid based because they tend to harbor bacteria more. Again, that warm, moist environment compared to a shadow or a pencil. Okay, so our eyeliners, liquid liners, we're keeping for about 3 months.
Yep, I would say 3 to 6 months.
I am not telling you how long I have mine for. Then the pencils, about 6 months.
6 months, yep.
Okay, an eyeshadow palette, maximum you would have that is 2 years, but probably closer to a year.
To feel better, yes.
To feel better so you don't end up in your clinic?
Yes.
Okay. Now, for our contact lens wearers out there, is there anything that they should be considering when it comes to eye makeup and eye health?
Number one, always put your contact lenses in first before doing your eye makeup because that debris can get trapped underneath the contact lens. Yeah. And then second, contact lens wearers, they tend to have drier eyes, because the blink rate is a little bit decreased when you're wearing a contact lens. Eye makeup also tends to dry your eyes just by nature of blocking the oil glands. So there might be a little more sensitivity to certain kinds of eye makeup, and it's hard to say, I can't say avoid this ingredient, only use this ingredient, because everybody's so different. Yeah. But if you're having dry eyes and you wear contact lenses and then you notice it's worse or exacerbated by your eye makeup, it might be time to kind of look at it and try switching it out.
Amazing. That's such a great tip to put the contacts in first. I almost feel like it's a bit counterintuitive and that you might not want makeup to fall on your contact lens. But of course, it makes so much sense that something could get trapped under the contacts.
And most people are nearsighted. So they're wearing contact lenses. They can actually see up close. So they don't feel the need to put on the contact lens first to be able to see well to do their makeup. But it's always best to put that contact lens in first.
One of the things that seems to be all the rage right now when it comes to our eyes are eyelash serums, growing our lashes. I'm so curious about this. What are your thoughts?
So this is something that I think a lot of people don't realize. There is a lash serum that you need a prescription for.
Yes.
And it has an active ingredient, which has been shown in clinical trials to grow your lashes. The thing is, there is a synthetic version of that same active ingredient.
Oh.
And the problem is that ingredient, which is called isopropyl chlorprestinate. If your lash serum or mascara has that as an ingredient in it, it's been shown to cause darkening underneath the eyes, which may or may not be reversible, and even atrophy of the fat around the eyes. So
what?
We don't want that, especially as we age. We want all the fat that we've got. That orbital fat atrophy gives you that really sunken look, which is not attractive. And people don't realize, oh, but I just bought it at the beauty store. No, it actually has this ingredient that's been shown to cause problems. So for lash serums, they work 100%. Everybody can do what they want to, and they need to make their own decisions, but just so that they're educated as to potential consequences and side effects. So I personally prefer just a lash serum that's going to nourish and condition the lashes. It might not actually cause the lashes to grow. Sometimes they've got things like castor oil and rosemary oil. You know, they've not really been shown in tons of studies to affect or change the lash cycle to promote lash growth, but it makes the lashes nourished, conditioned, healthier, so they just fall out less. So those are the ones I typically recommend.
Okay, amazing. Now, what would be a sign that would indicate it's time to go see an eye doctor? Something's going on with your eyes, whether it's related to makeup or not, you might not know.
I think if you have symptoms of something and it persists,
okay,
right? So if it is redness or tearing, there's a lot of things we just can't diagnose over the phone or over an email or a text message. So you want to go in to see us. It's usually relatively quick to get it examined and make sure it's not something more serious, because there are a lot of things that can cause redness, some serious, some just allergies. So it's difficult to say. But if you have symptoms, you're experiencing them, especially if you have any change in your vision, that's really going to be the hallmark. You want to get in to get checked.
Amazing. I have some incredible questions from our audience for our Ask Me Anything segment. The first one is, my eyes are so watery in the mornings. They're typically watery for at least an hour after I wake up, and I end up using my finger or a tissue to clear the water multiple times. She's cringing already. Oh no. Could this be related to wearing makeup daily or occasionally sleeping in my makeup?
You can wear your makeup daily. I do.
Yes.
It's totally fine as long as you clean it every night. So probably this person is not really getting everything off every night. She's already admitted, she's already admitted to wearing makeup to sleep at night. And that can dry the eyes, again, because it's blocking those oil glands. And so it seems really counterintuitive, but when your eyes are tearing, it's actually because usually they're dry. And what your body is doing is making reflex tears. But those reflex tears don't really coat the surface of the eye. They don't lubricate the eye as well as your basal tears. So when you wake up, probably just eyes are super dry. So if you start just like a really good regimen of cleaning your eyelids, even doing some hot compresses to open up those oil glands, it's going to help a lot.
Amazing. Next question is, I feel like I get something in my eye almost every other day. It's usually these thin, tiny strings that get caught in the top waterline or between my top and bottom lashes. How does my eye keep catching these little strings?
So there's actually a condition called mucus fishing syndrome. It's where your body makes mucus because it's being irritated. So maybe it's from the makeup, maybe the flaking of the mascara or the eyeshadow is getting into the eye, making these little strings of mucus. And probably what the person is doing is what we're all inclined to do when you have something irritating your eye. Use your finger and you fish it out.
Right.
That actually sets up a cascade to create more mucus. So first it's just cleaning better so you don't have that inciting event that causes the mucus, and to avoid touching the eyes. You really just don't want to be doing that at all. It's causing trauma to make more mucus.
So if we have something in and around the eye area, what would you recommend we use to wipe that away other than our finger? Because I'm guessing our hands have a lot of bacteria on
They
them.
have so much bacteria. So that's also why we just never want to rub our eyes in general.
Yes.
I would just clean it. Wash the eyelids, clean it, use an artificial tear. Doesn't need to be a full-on eye stream situation.
Yeah.
You can just do an artificial tear to really cleanse the eye and to get the debris out that's bothering it.
Okay, amazing. Whenever I use mascara, I get the flakes in my eyes. Can that be a problem long term?
Yes, because of exactly the previous question, which is it can cause the eyes to get irritated.
Yes.
And then can be a setup for dryness or other problems.
Does curling your eyelashes actually cause breakage?
So if you curl before you put your mascara on, not so much. But if you are curling your lashes, which my daughter just asked me the other day because it's the one makeup I let her wear is mascara, and they all curl their lashes. It's really crazy. Even middle school and high school, they curl their lashes. You don't want to curl it after the mascara because it's going to be stiffer after the mascara, and that's going to make it more prone to breakage.
Okay, great tip. Oh, I'm interested in this one. How often should I be cleaning my eyelash curler and brushes? I usually only do it once I see makeup build up.
And that's fair enough. But if you can do it once a week, cleaning more is never going to be harmful. Yeah. Now, makeup brushes, most people don't clean them once a week at all. But at least once a month minimum, at least every couple weeks would be ideal.
One more question here. I've been hearing a lot about blue light blocking makeup lately. Does that actually work? If so, what ingredients or products should I look for?
So there have been no studies that show that blue light blocking will cause less wrinkles. So here's the thing. People are just very excited about, screens and the blue light from your computer, your television, or your phone. But do you know what has 100 times more blue light than that? It's actually the sun. The sun has much more blue light emanates from it than your digital devices. So honestly, just wearing sunscreen is going to be helpful at preventing those wrinkles and fine lines that you don't want. I don't necessarily subscribe to having to buy makeup with a blue light type ingredient in it to block that.
Okay, amazing. I lied. I actually have one more question for you.
Okay.
I keep seeing these magnetic eyeliner and lashes on TikTok. What are your thoughts on having these magnetics so close to our eyes?
There's really not a problem with having magnets close to your eyes. You just have to be mindful if you're going in for an MRI. You don't want to have either the liner or the lashes on because the liner is usually made up of iron oxide so that it can attract the magnets on the lashes. So just don't put any of that on.
Would you say it's better than using a glue for lashes?
It could be. It could be. And again, some people are just sensitive to different things. Some of the carbon black, which make eyeliners really pigmented, can be very allergic. You can really get a reaction to that. So I would look at the ingredients. If you're someone that with sensitive eyes, do a little patch test. Try it on a little part of your skin first. See if it's causing a reaction before putting it all over. But I think that the glue that we typically use for lashes, it's cyanoacrylate, which is kind of the same thing as crazy glue. Not problematic in of itself, but again, kind of hard to get rid of.
Right.
It's hard to take off well. So it goes back to that whole thing about just removing your eye makeup well. So a lot of people they're not getting it off well.
Right. Amazing. Wow. I have learned so much that I didn't know in just this very short time with you. Thank you so much for sharing your knowledge and expertise with us. I hope everybody thinks a little bit more as they go into the next Sephora or makeup store and considers maybe avoiding the waterproof makeups, looking at a tubing or cream-based mascara and eyeshadow, and then, of course, really making sure we're cleaning our beautiful eyes every night before bed.
Absolutely. And thanks so much for having me. I think the key really is cleaning your eye makeup, being mindful of the ingredients, even things at Sephora or Ulta or just at your local drugstore. Some of those mascaras have a specific active ingredient for lash serums. And that can actually cause a whole host of different problems. So just really being mindful of what's in things that you're putting on this really sensitive part of your body.
Thank you.
Thank you.
Through November 30th, 2025, earn an entry for a chance to win $5,000 in the CareCredit Let's Get Digital sweepstakes. Enter the secret word VISION in the sweepstakes hub to earn one entry now. Head over to the sweepstakes hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States, D.C., and U.S. territories 18 years of age or older who have a CareCredit credit card as of 9/2/2025. Void where prohibited. Promotion starts 10/8/2025 and ends 11/30/2025. Grand prize and weekly prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.